Gender bias in randomized controlled clinical trials of pharmacological interventions for attention deficit hyperactivity disorder, ADHD. Authorship: Xavier Castells, Eugenia Baikova, Sacramento Mayoral, Ruth Cunill, Domènec Serrano. Affiliation: Universitat de Girona and Institut d'Assistència Sanitària in Girona, Spain, and Parc Sanitari Sant Joan de Déu in Barcelona, Spain. You can contact at xavier.castells@udg.edu. Although for practical reasons I have inserted this video in the abstract box of the poster, the presentation itself will cover the following areas: abstract, introduction, methods, results, and discussion and conclusion. So let's start with the abstract. Abstract. Study aim: to determine the extent of any gender bias, the factors that are associated with the highest risk of gender bias, and the impact of gender bias on the efficacy and safety of pharmacological interventions in ADHD patients. Methods. We performed a meta-analysis and meta-regression of randomized placebo-controlled clinical trials. The studies included and the data analyzed were downloaded from Minerva database at www.minervadatabase.org. Results: we included 117 studies that randomized over 21,000 patients. Overall, 32% of patients were women. The proportion of women was larger in clinical trials with a higher number of patients and those that enrolled adult patients, while it was lower in clinical trials where the presence of a comorbidity was an inclusion criterion. The proportion of women included did not affect the efficacy and safety of drug treatment. In conclusion, we found no evidence of gender bias in clinical trials investigating the efficacy and safety of pharmacological interventions in ADHD patients. Small studies include fewer women, suggesting that gender bias may occur in clinical trials testing new hypotheses. Gender does not influence the efficacy or safety of ADHD drugs. After this short summary, let me start with the introduction of the study. Introduction. ADHD is a neurodevelopmental disorder that affects both boys and girls and shows notable gender differences. For instance, girls with ADHD are frequently inattentive and have lower rates of conduct disorders, leading parents, teachers, and others to often overlook ADHD in girls as their clinical manifestations contrast with the stereotyped ADHD of a hyperactive boy. Given these important clinical differences, it is important that both genders are adequately represented in clinical trials. Nevertheless, this is unlikely to be the case, as it has been shown that women are underrepresented in study populations in many areas of research, particularly in clinical trials. This underrepresentation comes from the misconception that men and women are the same. Therefore, as women can become pregnant and this may represent a risk, female subjects of childbearing potential who do not comply with contraception requirements are usually excluded from clinical trials for safety reasons. The exclusion of women from clinical research results in gender bias, which has been described as an unintended but systematic neglect of either women or men, stereotyped preconceptions about the health, behavior, experiences, needs, wishes, and so on of men and women, or neglect of gender issues relevant to the topic of interest. In medical research, gender bias affecting women is far more prevalent than that affecting men. This study aims to determine the extent of any gender bias, the factors that are associated with the highest risk of gender bias, and the impact of gender bias on the efficacy and safety of pharmacological interventions in ADHD patients. To the best of our knowledge, this is the first study investigating the issue of gender bias in clinical trials in patients with ADHD. In the next 5 slides, I'm going to present the methods we used in this study. Study design. We performed a meta-analysis with meta-regression of randomized, double-blind, placebo-controlled clinical trials. Source of data. Studies and data were extracted from Minerva database at www.minervadatabase.org. Minerva database stores comprehensive information on administrative issues, study design, patients' characteristics, results, and risk of bias of all randomized clinical trials that have investigated the efficacy and safety of pharmacological interventions for patients with ADHD. Inclusion and exclusion criteria. We included randomized placebo-controlled clinical trials lasting at least 2 weeks investigating the efficacy of pharmacological interventions for ADHD patients according to the DSM version 4, 4th or 5, irrespective of age. We excluded studies that did not provide information on the proportion of girls, women included in the clinical trial. Study variables. The study outcomes were the proportion of women, clinician-rated improvement of ADHD symptoms, and proportion of patients dropping out due to adverse events. The study coverages were publication date, type of treatment, number of patients, age, and the presence of a comorbidity as an inclusion criterion of the randomized clinical trial. Statistical analysis. The study outcomes were expressed as follows. Proportion of girls women as rate. Efficacy on ADHD symptoms as a standardized mean difference, and dropouts due to adverse events as odds ratio. The results of individual clinical trials were combined using a random effects model. Between study variability was determined with the I-squared statistics, and the sources of variability were investigated using initially bivariate meta-regression, and lately those covariates that were found to be statistically significant in this analysis were included in the multivariate meta-regression model. Finally, we examined whether gender influences the efficacy and safety of pharmacological interventions for ADHD with the bivariate meta-regression. All statistical analyses were performed with comprehensive meta-analysis. Now I am going to present the results of the study. The results related to the first objective, which was to determine the extent of any gender bias, are shown below. We included 117 studies that enrolled 21,442 patients. These studies included a wide range of women, ranging from 0% to almost 60%, as you can see in the figure on the right. And on average, the pooled rate of girls, women with ADHD enrolled in these clinical trials was 32%. As you can see, there is a wide variability in the proportion of girls, women included in these studies. And in the next slide, I'm going to show what characteristics are associated with the proportion of women included in each study. The results related with the second objective, which was to determine the factors that are associated with the highest risk of gender bias, are shown in the table 1, which is below this slide. This table is divided into sections. On the top you can find the results of the bivariate meta-regression analysis, and at the bottom the results of the multivariate meta-regression, which included those covariates that were statistically significant in the bivariate analysis. The bivariate meta-regression shows that the type of drug, number of patients, age, and comorbidity are statistically associated with the proportion of girls, women in the randomized clinical trials included. Of these covariates, I'd like to highlight that age itself explained about 61% of the variance. The covariates that were statistically significant in the bivariate analysis were included in the multivariate one. And in this analysis, the type of drug was no longer statistically significant. The number of patients and age were associated positively with the proportion of girls, women included in clinical trials, while comorbidity as an inclusion criterion was negatively associated with the proportion of girls included in clinical trials of patients with ADHD. This model explains 70% of the variability in the proportion of girls, women included in clinical trials. In this slide, you can find the results of the analysis of objective number 3, which was to determine the impact of gender bias on the efficacy and safety of pharmacological interventions in ADHD patients. On the left, you can find the results of the meta-regression analysis between gender and efficacy, and on the right, the meta-regression analysis between gender and safety. Efficacy was expressed as improvement on ADHD symptom severity, and safety was expressed as the proportion of patients dropping out due to adverse events. In this analysis, we found that the proportion of girls and women included in randomized clinical trials of ADHD patients was neither associated with the efficacy of pharmacological interventions nor with their safety. I will finish this presentation with a discussion of the results of the study. We have found that overall, 1 out of 3 patients enrolled in clinical trials investigating the efficacy and safety of pharmacological interventions for patients with ADHD are girls, women. This suggests that women are not underrepresented in this study, as this rate falls within what is seen in clinical samples. Also, as in clinical practice, the proportion of women is larger in patients without comorbidities and in the adulthood, being the later the cover rate that has been found more strongly associated with the proportion of girl women enrolled in clinical trials. Small studies include a smaller proportion of women, suggesting that gender bias might occur in clinical trials testing new hypotheses. Nevertheless, this association is weak. Gender plays a little role when tailoring the pharmacological treatment for patients with ADHD, as our study found that gender influences neither the efficacy nor safety of ADHD drugs. Study limitations. Like any meta-regression, ecological bias can affect the results of this study. This bias occurs because we are analyzing aggregated data, not individual patient data. A good example to illustrate this bias is to analyze the relationship between the consumption of chocolate and the number of investigators that have won the Nobel Prize at a national level. We can see that there are more investigators who have won the Nobel Prize in countries with higher rates of chocolate consumption. An ecological bias occurs when we erroneously conclude that chocolate consumption is associated with a higher likelihood of winning the Nobel Prize. This conclusion is not correct because we do not know if the investigators who have won the Nobel Prize actually eat chocolate. Like any observational study, confounding bias can affect the results of the meta-regression analysis. This is due to the fact that the independent variables analyzed were not assigned randomly. Gender bias in the authorship of research in ADHD is a particular form of this bias that was not investigated in this article and should be analyzed in future studies. Conclusions. In randomized controlled clinical trials investigating the efficacy of pharmacological treatment for patients with ADHD, we have found no evidence of gender bias, no differences in efficacy and safety between female and male patients. Thank you very much.